Hi, and welcome to the Balanced Body Rehabilitation Series. Today we're filming from PHI Pilates Studio in Pittsburgh, Pennsylvania. My name is Christine Romani Ruby, and I'm a physical therapist working with Nancy. Today we'll be demonstrating exercises to use with the shoulder. Anytime you have a shoulder injury, you have a risk of losing that normal scapulohumeral rhythm. This is an exercise that I use sometimes at the beginning of the rehab series, but also toward the end when I'm trying to teach a client how to get the scapulohumeral rhythm back so that they can move normally when they no longer have pain. So Nancy, let's go ahead and have you come down into the mermaid position. So this is an exercise called mermaid. Many times patients can't sit in this position because of their knees or their hips. So Nancy's able to, but if she were not able, I would simply bring her up on a box, putting a moon box right underneath her pelvis or a yoga block so she's sitting up a little higher. Then we wouldn't have as much rotation at the hips. So once she gets into position, we're going to think about having the ASIS facing straight forward, right in line with that reformer. So we want that part of her body to be in that sagittal plane, or in that frontal plane, okay? Her chest is also going to be in the frontal plane. We're going to make sure to put that hand forward into a position of scaption. And one thing that's really nice about this reformer is I can move that foot bar in. I want that foot bar to be in close enough that she can have her elbow slightly bent, because we're going to use that to our advantage. I want her to create some outward rotation at her shoulder so that we can kind of get that humeral head back into the socket of the scapula. And then I want you to lift up a little bit with your sternum so that she's sitting really tall and her back muscles are engaged. Now we're going to work with only the arms. So I'm going to start first on a blue spring, and then we'll take this lighter. So Nancy, I want you to push away. You're going to inhale and think of straightening the elbow. Now exhale and bend the elbow to come back in. And you can just go ahead and keep doing that. Now what we're looking for is that her body doesn't lean into the bar and that her shoulder doesn't elevate. We want to keep the upper trap out of it. As she pulls back in, we want to engage the serratus anterior. Okay? So the serratus comes in combination with the abdominals. They co-insert. So these two muscles have to learn to work together. And we also need to get that scapula to move with the rib cage. So we have a closed chain effect because the hand's on the foot bar. And then she pulls back in. So I always really encourage push and pull. Now where this really makes an effect is when I start to take the tension away. So Nancy's done this before, so I'm going to go ahead and take all of the springs off. So Nancy, we're going to go ahead and be careful because at end range you're going to kind of fly. And then you're going to bend and pull yourself back in. So it's the push is somewhat important, but it's the pull where they actually have to create some outward rotation and they have to engage low into the scapula and get some scapular stability. And exhale as you pull back in. You're doing great. Good, 2 more to go. Now once they've achieved this in a nice tall position, we want to start to begin to add some movement of the torso. So I'm going to go ahead and put some spring back on there. We're going to put a blue on. Okay? And now what's going to happen is we're actually going to move the rib cage on the scapula. And that's how you trick them into healthy scapulohumeral movement. So we're going to keep that elbow bent, and we're going to do the full mermaid now. So you're going to have your other arm out to the side. She'll push away. That elbow bends. She side bends at her torso, keeps this shoulder down, and then she brings herself back. And that elbow bends on the way back. And that's what you really have to watch, that the elbow still extends and bends. So she's going to inhale, push her way out, side bend, and then exhale, and she's going to pull back in. You just have to watch for the elevation here. She elevated a little bit on that one. So don't worry about going so far. You're going to pull down, side bend, and let that elbow straighten a little bit. Good. And now pull back in from the elbow and come back. Nice job. You can sit nice and tall. So the key to this exercise, I feel, is the closed chain activity. And also being able to now say, you know what, you're not raising your arm, you're moving your torso. Sometimes when people are in pain and they think about moving their arm, they can't get anything natural. But if we sort of trick them into a movement of their torso rather than movement of their shoulder, they can give us a much more normal movement. Thank you for joining us today, and hope to see you for the next rehab series.